friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like I said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you. Hello and welcome to Physical Therapy Thursdays on Louisiana Living. I'm Dr. Jerry Yarborough and this is my sweet wife, Angela. Today we're talking to you about neck pain. Neck pain can be caused from a lot of different things. Now, if y'all remember in our earlier segments, we're talking about the spine. And in our neck, we have 7 vertebrae. And things that can happen just in the spine to cause you pain is you could have degeneration of the disc, which will cause the spacing to narrow and impinge on the nerves. You can have a disc herniation or bulge, again, pushing on the nerves. And the nerves in your neck not only innervate your neck, they also go down your arm. So you can have arm pain and it's coming from your neck. So whenever you're having neck pain, you really need to seek medical help from your healthcare providers. And here in Louisiana and Arkansas, you have direct access to a physical therapist. So you can call your therapist. They'll put you through a thorough evaluation to determine what is the cause of your neck pain. Now, physical therapists do work very close with your primary care providers. And if they see something that you need to go to them for medication purposes or even imaging purposes, that definitely would send you immediately. So don't hesitate. If you have some neck pain, don't let it last more than a day or two at the most. Get on the phone and seek help. So with neck pain, a lot of things that we do in physical therapy and or occupational therapy to help decrease your pain is, we do some manual work after a thorough evaluation if we find that you've got tight muscles. A lot of people's neck muscles, especially the real deep ones, get really tight. So we are, specially trained. We do some deep tissue manual work. And in a position like this, we can move right into doing some nice traction, opening up the spaces between the vertebra, allow more space for those discs, relaxing the muscles, and actually lubricating all the joints in your spine. So, from here we could do some stretches and even move right into some strengthening exercises. So you push against my hand here, push, 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 push. Okay, and push over here. Some other things that we do here at Fyzical, we have class 4 laser, and we can provide a laser that's an accumulation of light energy. It penetrates down to the cellular level, and when it does that, it decreases pain and inflammation. We could also do trigger point dry needling, in which we insert very fine needles. We don't inject any medicines. We just insert a solid needle into the tight muscles that causes it to relax. And many times we get very good relief and help by doing dry needling. So those are just some of the things that physical therapy can do. I want you to come back in the next segment, and I want to show you some things that you can start doing immediately at home to try to help relieve your neck pain. Welcome back to our final segment for the day. I'm Dr. Jerry Yarborough, and this is my sweet wife, Angela. We're the owners of Physical Therapy and Balance Centers of Ruston and Jonesboro, Louisiana, and now El Dorado, Arkansas. Today we're talking to you about neck pain, and in this segment we're talking to you about things that you can do immediately to start to help decrease your pain. All right, remember, everything that we show you should decrease your pain. It should not increase pain. If it does, please stop doing it and seek help from your healthcare providers, okay? All right, so at home, you can easily do some good stretches, okay? Cervical stretches. You're gonna take your ear toward your shoulder just as far as you can. You should feel a good stretch. You're gonna hold that for about 10 seconds and then go to the other side, all right? I want you to do that at least 3 times. And again, you can hold it 10 seconds to 30 seconds, and that would be good. And then rotate as far as you can to the right, and then to the left. Again, holding each one at least 10 seconds, up to 30 seconds, and do it 3 times, all right? Then bring your chin to your chest, feel a good stretch, and then look up at the ceiling, okay? Again, you wanna feel a good stretch, doing them all for 10 to 30 seconds, at least 3 times. So that's a good stretch. Now, a really good stretch for your deep muscles here is bringing your chin straight back. You're gonna feel a little tension in your lower, at the lower base of your head, okay? You're gonna hold that for 10 seconds and do that 10 times. Okay, now to get in a little strengthening, we're gonna do those same motions, but this time you're gonna resist them. It's called isometric exercises. So you're gonna put your hand on your jaw, right or left. You're gonna push into your hand as if you're trying to turn that direction. You're gonna hold that for 10 seconds and do it 10 times. And then you're gonna do the other side the same way. Okay, the next one is put your hand on your temple, and you're going to try to take your ear toward your shoulder, and you're gonna push into your hand, just kind of moderately. Again, don't cause pain, and don't make it to where like you're shaking or anything, okay? And then do the other side. You're gonna hold them for 10 seconds and do each one 10 times. And then you're gonna push on your forehead, okay? Same thing, and then the back of your head, as if you're trying to look up. All right, and a very good way for you to do cervical traction on yourself at home is to use this part of your hands, and you're gonna put it at the base of your head, and you're gonna try to pick your head up off your shoulders, straight up off your shoulders. Try to hold it 10 seconds, 10 to 30 seconds, and do it 3 to 10 times. That is a very good traction and will really help decrease pain and muscle tension. Now, another home device that they sell, or we even sell them here at our facilities, is a cervical traction pillow. And it's very easy for you to do. You put it on, it Velcros on, and then you got the pump. You just pump it up until you feel a traction. You can put that on there every day for about 10 minutes. Really help manage some chronic pain for you. And you do it while you're sitting still, watching TV or what have you, okay? All right, so those are some really good things for you to start doing today to help decrease your pain. Don't forget, if that isn't enough, you need to give us a call. You do have direct access in Louisiana and Arkansas to your physical therapist, and we would love to help you. Come back and see us next week. Thank you.